Hi, this is Julia Cha, and this is my presentation for building a community. Before I begin my actual presentation, I wanted to throw a couple of questions out to the audience that I just want you to answer yes or no to in your heads. The first is, have you ever gone to a hospital before for any kind of checkup, scan, or surgery? Have you ever accompanied a family member or a friend to the hospital? Have you had all your questions answered before when you or the person you were concerned about were at that hospital? And have you ever come across any problems with the expenses that come with going to the hospital? Now, for me, the answers to those questions is that I have gone to the hospital before for a checkup, a scan, or a surgery, and I have accompanied a family member or a friend. In the occasions that I have gone to the hospital, sometimes I will leave having all of my questions answered, and sometimes I'll leave having none of my questions answered, and I won't know anything about what's going on with the procedure. And this happens due to either time constraints or the doctor's lack of explanation. And while I haven't yet come across any problems with paying for the expenses that come with going to the hospital, I know plenty of people who have. The reason why I'm asking these questions is because for the majority of people, healthcare is essential. It's essential because it preserves the physical and mental well being of humans in general, and at some point in our lives, we will find ourselves in the hospital for something. And to remain a productive society, a person needs to be healthy or given the chance to be healthy. And right now, with the US system, it doesn't seem like we have that chance. In my previous presentation for Articulating a Perspective, I talked about the flaws in the healthcare system. Namely, I talked about the fact that in the US, there is more spending on healthcare than in any other country, yet our health outcomes are one of the worst. When our system is so backwards, how can we expect to put our trust in any health professionals that we come across to help us become healthy? When I talked about the fact that sometimes when I went to the hospital, I didn't walk out of the hospital fully informed about my or my family members' situations, I wanted to emphasize that the system where doctors are made to focus on practice revenue is essentially reversing what the healthcare system should be about. Why, when I spend so much on my health, am I seeing no improvement in the long term? Why, when I ask questions about my health, are they brushed off with curt explanations because the doctor has to see the next patient? Healthcare and the job of health professionals is about making the patient feel safe, comfortable, and informed about their situation. So, why should it be a guessing game whether I'll have all of my questions answered about my body the next time that I go into the hospital? Shouldn't it just be an outright obligation for those health professionals? Is my question. What I think is that the US is underperforming in primary care, where we as patients are not given relevant clinical information about our conditions from the physicians, and this is a huge problem that needs to be fixed. And on that branch of thinking, another one of the biggest flaws within the US healthcare system that needs to be fixed is that it is exorbitantly expensive to get treatments here. When we look at other healthcare policies in countries like the UK, Japan, the Netherlands, Germany, or Taiwan, we can see that the focus of healthcare is less on the administration and more on the outcomes of the patients. In these countries, there is also more insurance coverage overall, and having more insurance can decrease the amount of mortality because it's considered a public health intervention. Oftentimes in the US, people cannot afford coverage and therefore remain uninsured because the guidelines for attaining insurance isn't expanding, and many people don't see the worth of having it because when they get the bill for their medical expenses, even when paired with co-payments, they see basically no difference. But this is not to say that these countries have like the best policies in the world, because all of them have flaws like overcrowding in hospitals due to free healthcare or even problems with funding of the system itself. But the bottom line is that the health outcomes of people living in these countries far outrank the health outcomes of people living in the US. So why shouldn't we strive to improve that statistic? Basically, what I'm trying to get at with this presentation is that with the way the healthcare system is in the US, most of us will experience these problems. But with not completely understanding our situations or our treatments, why do we see no motion for change? I mean, we're all experiencing these situations, so why can't we all band together, is my question. In my opinion, not only do we need to inform people that this is happening right now, but we also need to see changes within the way that we make our insurance plans or see offers to, see different types of insurance plans. We also need to see changes where we transition our focus from trying to get more patient turnover and more monetary exchange to focusing more on primary care and helping patients see better health outcomes because they know what's causing their health issues. The issues surrounding the US healthcare system needs the American people to act as a community so that we can see a change that will help all of us. And basically, to finish out this presentation, I want to ask you guys whether you have had any bad experiences with the healthcare system and what you think should be done about it. Thank you.